All right. Thank you so much for sharing some folks. It looks like there's a few Midwesterners in here, so that's always fun. Um, I will be recording this session today, so if anyone wants to watch it afterwards, feel free to just wait for that email and it will be posted on the website as well. My name is Callie and I'm the program coordinator here at the City Health Dashboard. I'm also joined by Dana, our research analyst, and she'll be responding to folks in the chat and monitoring that. So if you see that name pop around, just know she's also with us. Um, and yeah, so without any more, let's get into it. Today, I'll be doing a brief overview of the City Health Dashboard before diving a bit deeper into our most recent data release, which came out in December of last year, and talking a bit more about some interesting findings that we saw in chronic absenteeism and giving that a bit more context. I'll then end today's session with a live Q&A, so if anyone has any questions throughout, feel free to pop those in the chat and Dana will be monitoring that. But at the Q&A session, you're more than welcome to hop off mute. The session's pretty informal. There's not too many of us on here today, so if you have any specific metrics you want to look at or cities, feel free to let me know and I can hop into those afterwards. But to start, I'll just give a little bit more of a background on the dashboard, then I'll do a little demonstration of the site before going into the data release. So here at the City Health Dashboard, our goal is to help cities across the US leverage the power of data and to improve the health and well-being of everyone in their community. So how do we do that? We launched the dashboard back in May of 2018. It was developed by our team here at NYU in the Department of Population Health, and we've worked in close collaboration with the NYU Wagner School of Policy, as well as some of our partners, including NLC and ICMA. We also worked when we were first launching with our 4 pilot cities to create an easy to use one-stop resource to help make communities more healthy and equitable. Today, our dashboard includes over 40 metrics of health and its drivers for over 970 cities nationwide, and we continue to add cities annually to make sure that we're expanding and being more as inclusive as possible with data accessibility. So our goal here, as I said, we want to be an easy to use one-stop resource for every user. And our user base really ranges from health professionals, city leaders, to everyday community members. So really anyone interested in local data for their city can hop on the site and be able to look at it and know what's going on. So we do that by developing and testing our site and metrics with a diverse group of community and city leaders. We continually improve upon and upgrade our site. We carefully check our metrics and select based on very stringent criteria. And we also use an initial implementation and user testing to ensure our site is good for a wide range of audience members. And our website is also developed by experts that make sure to prioritize accessibility as they're working on our site. So metric selection is very important to us because we want to make sure that we can vet all of the data that we are showing on the site. So we ensure that every data that we put on the site has gone through this process. We ensure that the data set is national and will cover all of our cities that we have on the site. We ensure that there are rigorous methods underlying the original data collection. All of our measures are aimed to be actionable and reflect upon public health priorities at the city level. So we want to make sure that they're relevant metrics for all of our users to be able to use. And finally, we want to ensure that there are regular updates to the metrics because we do want to remain timely. And this is across our 5 overarching domains. So those domains include clinical care, physical environment, health outcomes, health behaviors, and social and economic factors. So today on the site, we have over 40 metrics. We add metrics as data becomes more available. And as you can see, we have about 17 metrics right now that are also providing demographic breakdowns. So that includes breakdowns of the metric based on race and ethnicity, as well as sex. So this is really useful as you're looking to get even deeper into the data. So People use the City Health dashboard to compare health gaps across neighborhoods and really dig deeper into what is causing those differences. You can use it to compare your city to other cities in other regions or with similar population sizes or demographic factors to help you set goals and learn from what others are doing. And finally, you can also use the dashboard to set priorities and better target resources to neighborhoods that need them the most. Um, so this is super useful tool and we're excited to be able to share this with you. So without further ado, let's actually dive into the site and look a bit more at what our tool has to offer. So if you go right here to City Health Dashboard, this is what you'll see on the main page. So you're met with this tool. You can easily put in any city that you can think of here and go to it from there. If you scroll down, you can see we have some research and reports. So we do perform some research here at the dashboard, and those papers will show up here. Any upcoming events, so you can see today's virtual office hours and next month are already here on the dashboard, and you can register for them here. Impact stories are some use cases of how people are using the data and how it's helping their communities. And down here, you can see any latest news. That includes a lot of our site updates. On the left here, there's that main menu navigation bar, and I'll go back to this in a little bit, but first let's dive into the site. So to start, I'll go to my hometown of Burbank, California, as a little example. And so if you go here, if you click into the city, you can either choose any metric from this list, or you can choose the city overview. So we'll start with the city overview just to get a brief kind of look at how the city's doing overall. So as you go through, you can see all the different metrics that we have available. Once again, it is sorted by those overarching domains. As you scroll down, you can see if there's a check mark, it means that the city is actually performing better than the dashboard city average. And that dashboard city average is kind of a proxy of what a national average would be. We average all of the cities on the dashboard to get this number. So as you can see, if you click into one of the metrics, then you can get this view of what that looks like in your city, broken down by the scale bar, where lighter colors will always indicate better outcomes. And so you can know this as you go through to kind of see how is your city doing relative to these other factors. And sometimes it takes a moment to load. But here we can look at high school completion. Say we want to click into one, we can actually click on the map, and that's an easy way to get to this metric detail page. Or at the top, you start off in city overview, then you can just click here to metric detail. If you want to learn more about the metric, you can click this little toggle and it'll show you what the data source is, data availability. So this one isn't just at the city level. You can also break it down by neighborhood or census tract. So you can go even deeper into your city. And then there's also demographic groups available for this particular metric. And you can find all that information right here. So here on the metric detail page, we see this visual of the city. And if you click into any of these census tracts, you see this estimate of high school completion for that neighborhood in this city. Say if there is a neighborhood that's of interest to you, you can star it. So here I'd already actually starred this one before. And all of your saved tracks will show up here on the right with the census saved tracks value. If you want to highlight any tracks that you've already saved, you can click on this little eye icon and they'll show up here in this highlighted purple, and that makes it even easier to kind of spot them as you go through. Here on the left, once again, we see the same scale bar that we saw in the city overview page, and this shows you kind of the range of colors on lighter being better outcomes in this case, and there'll always be a check mark to help you indicate, as some measures are actually going to be the opposite direction. So just always look for where that check mark is, where those lighter colors are, to help orient you to how your city is doing for a particular metric. In this case, we see that Burbank has a higher high school completion rate than the dashboard city average in 2021. And as we go through, we can kind of see how particular metrics are doing. For saved metrics on the right here, we can see how it's doing compared to the average, again, with that same type of scale bar functionality, but for that particular census tract. You can also hear for almost all of our data on the site. There are multiple years, so you can scroll all the way back to say 2013, and it will keep any highlighted census tracts that you have, so you can kind of see how are these particular tracts or neighborhoods doing across years as you look. So we can see here, Burbank is still doing better than the dashboard city average in 2013, but is doing better in 2021 and 93 as opposed to 88. So this is an interesting way to kind of see this data across different years. If you want and you prefer, you can also look at this data in a table format, but personally, I'm a visual learner, so I like having this sort of map feature. You can zoom in, zoom out. It's nice to be able to see across cities. Next, you can go to the demographic detail page. We're just following along this navigation bar. And here you're able to see this metric broken down by race and ethnicity, as well as by sex, so female and male down here. So for high school completion, the first thing that it will tell you is what percent of Burbank, the city's population, is of that racial and ethnic group. So for in this instance, it's 11.7% of Burbank's adult population is Asian. And so then as you look here, then this is saying the dashboard national average for Asians, high school population, high school completion rate, and what is Burbank's Asian high school completion rate. And so we see that these comparisons go across all these different racial and ethnic groups. So you can kind of see how are different racial ethnic groups doing throughout the city for this metric. And then the same sort of thing down here for female and male. You can, once again, change between years here. If we continue on, you're also able to compare across cities. So if you have a certain city you want to compare to here, you can just type that in. So for instance, I don't know, Tuscaloosa. Say if you want to click there, then you can see, and it will load, and you can compare across these cities. Say if you don't have a particular city in mind, but you want to get a city that maybe has the same Hispanic population and say population size as Burbank, you can click into these things and it will filter now by all the cities on the dashboard that meet those criteria. So say you want to compare to San Mateo, California, you can click there, and then that city will come up here for a general overview of the city, but also can break it down by the demographic groups when available. So this is a great way for you to kind of find cities of comparison to see how your city is doing compared to others. Another way that you can filter, not just by general characteristics, but is also by dashboard metrics. So this is showing you what are the ranges that Burbank's particular metrics fall under for these. So if you want to say compare to cities that have similar rates of children in poverty, you can click here and it'll show you those same cities. Well, it'll filter out. The more things you click, the smaller the list will be. So if you have very specific criteria, you'll be able to find that here. You can also compare between metrics within your city. So for instance, if we wanted to look at high school completion and say rates of children in poverty in Burbank, we can do that here. You can see both of these are going to be for the year 2021, and you can change any of these dates here. If you scroll down, it'll show you this visual representation. The original metric will be shown in that same scale bar color format, while the second metric selected will be shown in this kind of bubble scale bar format. And so as you can see, it's still the same where the lighter colors will indicate the better outcomes. And as you go through, you can visually get this representation. If you click into a certain tract, it'll then show you what the estimates are for both of those two metrics. If you want to put them side by side, it will automatically also give you this scatter plot view. And this will, if you click onto any of these, it'll give you, once again, those estimates for that particular tract. Then as you keep scrolling down, if there's demographic details available, they will also break it down for the city for both of them. So you can, once again, kind of compare back to back these two metrics. The last two things on the navigation bar are our take action and our city highlights page. Really quickly, the city highlights page will just give you any sort of blogs or stories that include either your metric of choice, so in this case, high school completion, or your city of choice, so in this case, Burbank, and these are just relevant articles. The take action, I think, is pretty helpful here. It'll sort our take action resources, which is a curated list that we provide on the dashboard of helpful policies and programs, partners, strategies. It'll sort that all by your metric already. So if you click in, it's showing you high school completion, relevant policies and programs. So what you can actually do to move from data to action in your city. So this is helpful. You can then further filter it by, for instance, audience, policy program, evidence rating, and you can do this for all of these take action resources. If you want a more general look at Take Action resources after you've kind of explored multiple metrics in your city, if you go on this left navigation bar, you can navigate to the Take Action page. And here you can now filter by any metric. You can select multiple if you'd like, and you can kind of go through and see what our suggested policies and programs are, or again, any of these other Take Action resources. The last thing I want to highlight on our site is that all of our data is available for free for download, and you can get there by just going to the data access page here. All of it, city and track level, is available for download. We offer download either the entire site or cities by state. So you download the whole state to find your city. If you want, this is all for the most recent year of data. So if you want multi-year data, then you have to go down here to the API and work through our API to get multi-years of data. If you need any help at all along the way, we're always here. My team is here to help you, and you can just email us to have us walk you through that. If you want more information on any particular metrics or how we calculate it, our technical document is a great place to start. And then otherwise, our codebook kind of shows you exactly how we did code for a lot of our measures. And so that is main highlights of our site. So continuing on, let's now dive into the December data release. So as I mentioned previously, we always try to remain as timely and up to date as possible as we try to update our site. And so in December, we had a data release. We updated 11 metrics with new years of data. I've listed them out here. We also changed our data source, updated our data source for chronic absenteeism. So our chronic absenteeism metric, I'll dive into it a little deeper in a second, but we updated our data source to include both the National Center for Education Statistics as well as the US Department of Education. And this allowed us to add many more years of data. So now our data on the site ranges from the 2017-2018 school year all the way through to 2022. And then finally, our update included launching our API, relaunching it. We took it down to help improve the user experience. So now it's back up and people can once again access multi-year data. So let's talk a little bit about chronic absenteeism. So every time as we go through a data update, we make sure to look at the data and validate it. And sometimes we see interesting trends. So in this instance, we saw a trend arise for chronic absenteeism. So chronic absenteeism on the site, we define that as the percentage of public school students who miss 10% or more school days in the academic year. And so we've seen a national trend over the past few years with COVID of rising rates of chronic absenteeism. And this has also been reflected in the data that we have on the site across all dashboard cities. We see that compared to the 2017-2018 school year, absenteeism has nearly doubled across all cities on the dashboard, reaching about 30% rates in the most recent year of data in 2021 to 2022. Research has been done on absenteeism for years, and it's shown that reducing chronic absenteeism rates can lead to better education and health outcomes. And being present at school provides students with a range of learning experiences and essential resources to emotional and social support systems, food and nutrition, healthcare. And so along with all of our metrics on the dashboard, we really like to understand the social, economic, and political factors within a community that are key to adding context to these data on our site and interpreting these numbers. So we understand that there's a lot of structural factors such as segregation, poverty, unpredictable work schedules, interactions with the justice system that have historically contributed to disproportionately higher chronic absenteeism rates among certain racial and ethnic minority students. And so we broke this down, this trend down by different demographic groups here, as you can see on this graph. And we noted that Black and Hispanic groups throughout dashboard cities were experiencing the highest rates of absenteeism compared to Asian and white groups, which were experiencing the least. But among all of the groups, we saw that there was still quite a huge spike in absenteeism from, again, that 2017-2018 year. This is super important because a lot of this is understanding the context of the pandemic. A lot of schools moved to virtual learning environments. Teachers struggled trying to make hybrid learning work with school attendance, and it's all kind of reflected in these rates that we see here. Last September, the White House actually called for an all hands on deck approach to try to combat absenteeism because of this stark rise, since they've also noted that irregular school attendance is a predictor of high school dropouts, which can be linked to poor labor market prospects, diminished health, increased involvement in the justice system. And so, as a way to kind of combat that and prevent that, we wanted to kind of look at what can we do within our communities to combat chronic absenteeism and kind of start to get those rates down. So we took this as a little thought project and try to think about what are some considerations that our communities using our data on our site can take into account as they're looking at these chronic absenteeism rates and trying to think about how can they combat this. So these were a few questions that we thought could be useful. How can streets and modes of transportation be safe and more reliable so that students have an easier time getting to school each day? When a teacher reaches out to a parent or guardian to discuss their child's presence in school, does the parent have reliable broadband or Wi-Fi access? Do they have reliable cellular service to receive the communication in a timely manner? And how can we make access to these communication methods more widely accessible and available? Are school materials, for instance, including parent outreach, made accessible in the languages of the surrounding community? So that means not necessarily just English communications, but are we also providing those school materials in other languages that might be more native? And are these communications posted on platforms where parents and students can engage with and receive regularly? And then also, how might wider youth and mental and emotional health concerns impact a student's desire to make it to class and their perception of school safety and importance of going to school? What mental health supports can be put in place within and around schools to help students manage these anxieties? So there's a lot of considerations that we kind of found as we were looking through these data and trying to contextualize these trends within cities. And so you can always go and explore chronic absenteeism rates in your city on the dashboard. We also have a lot of other metrics that might be useful for understanding these trends, including children in poverty or broadband connection. And then finally, again, as I mentioned in my walkthrough, we have a lot of take action resources on the site focused on chronic absenteeism, but also just focused in general on improving accessibility of health and well-being in your community. So looking through those and seeing what steps might you be able to take in your community. So that was an interesting finding that we had coming out from our latest data release. So that concludes my talking portion. Thank you all for tuning in. I'll now open up the floor for a Q&A session. So if anyone has any questions, feel free to come off mute. Otherwise, I'll take a moment to look through the chat and the Q&A right now and see if there's any other questions that I can answer. But for all of you, thank you so much for joining. I'll be staying on for the whole time, but if you don't have any questions, feel free to hop off. Thank you so much. Let me look through the chat. I see there's a question here on digital inclusion data. So I'm not actually sure on what type of digital inclusion data we collect, but we do have, I'll be sure to reach out to the data team and I can actually follow up with you after the call to see
Okay,
more information
thank
on.
you. I took myself off mute, but I work in a digital inclusion space, and I think this is really a good dashboard. But now, when you're giving your presentation, you talk about chronic absenteeism and how not having internet impacts people. I'm hoping that maybe you can think about, if it's not on here now, to include it, because I think it. I've just read something that said that internet is a super determinant of health,
Yeah.
because there's a lot of things that people can't do if they do not have access to the internet. So if it's not on there, please consider adding it based upon how it impacts. Sometimes it can impact people's health.
Yeah, no, that's a huge. We do have broadband connection, so I'm not sure. So broadband connection is our Wi-Fi metric that we do have
Okay.
on the site that kind of goes along with that. But do you mind expanding a bit more on what you mean by digital inclusion? I see that we have a question in the chat about what that is. Just
Oh, we call it, we use the term digital literacy, and that means having broadband at home, having a device, and having access and knowing how to use it. That's the
oh,
term, the digital inclusion, I mean, digital literacy, and I should have put literacy. That's the term that everyone uses in that emerging industry is what is digital literacy, and it's those three things. So there's broadband on here.
yeah. Yeah, and I can
Okay.
actually I mean, I'm sharing my screen so I could show you. But yeah,
And
so
thank you everyone for allowing her to help me.
um yeah, so if you go into any city on the site, I guess we can go,
Let's do St. Petersburg, Florida.
let's do it. St. Petersburg, Florida. So if you go to St. Petersburg, we have broadband connection here. So you can see here,
Okay.
I don't know if it's fully loaded. We can zoom in because it's a little far out. But yeah, so you can see here some areas that have better broadband versus not as much broadband. And we can see all that range right here on the left. We have
Okay.
data all the way through 2017 as well for broadband.
Okay. Please don't, I don't know how I missed that, but now, because the hardest information to get is whether or not people know how to use it. So
Yeah.
no one in the industry has figured that out yet, how to access, how do you know that people know how to use it? But thank you for this.
Yeah, of course.
And I
And
wanted
yeah,
to
just
make
please
sure
figure
you
out a
had a
way.
question. I wanted you to make sure you had a question, so thank you.
Yes, of course. Thanks.
Is this the latest data you have, 2017?
Yeah, so this is the latest data for the city. We will be having another data release this summer where we'll be updating years of data. So if you look here at the change metric, all the ones that say updated are the ones that have the most recent year of data. If they don't say updated, it's very likely we'll be able to update those data in the coming data release. But it will always be this 2021 or whatever is the top year will always be the most recent year of data that we have available.
Okay, because thank you. So it didn't really move over the last couple of years.
Yeah, it doesn't seem like, and you can kind of like look, I mean, 2017 to 2021, it looks like it moved a little. But you can kind of compare across years. We have for broadband, at least we have 5 years of data
Okay,
on the site.
okay. Thank you so very much.
Of course. Thanks for asking. If anyone else has any other questions or wants me to dive into their city in a little more detail, I'm happy to do so while we're still here and live.
Hey
Thank
Callie, this is Kristen from Evanston, and
Hi.
hey, thank you so much for this. Always great to see. And we, yeah, just really rely on this high quality, stratifiable data in Evanston. So thank you so much. One question that I have for you that you kind of started to answer, I think, is just, as we're starting to think about our next iteration of our community health assessment, one thing that's always like tricky to know is like when to pull the, when is the latest to pull the data? Because you don't want to like pull the data and then find out that like you guys are doing an update, in 2 weeks from now. So you mentioned there's going to be another data refresh in the summer. Do you know like roughly, do you have like any more specifics about when in the summer and what that would cover?
Yes, not so much the specifics on what it will cover just yet, but I know that that will be coming out sometime, I believe in July. If you have a particular metric of interest or anything like that, feel free to, I mean, you can let me know now or just email us afterwards to see if there will be, if that might be included in the data release and we can kind of look into that a little deeper for you.
Okay.
But in general, we tend to have about 2 data releases each year and they don't cover the same metrics. So like I was saying, if they were in the December data release, it's likely that there'll be other metrics that will be updated for the summer one.
Okay.
It's just based on when the data sources come out with their data, which they do tend to lag a little bit, unfortunately.
Right. Yeah, and just a follow-up question to that, is that like a like like ongoing cadence for you, like July and December? Is that like pretty constant from year to year that those are the times that you update your data?
We roughly try to update sometime in the summer and sometime in near the end of the year winter, just because that is typically kind of aligned with when those data sources do
Right.
update. So that's been pretty regular for us. But we also say if there were like a huge data release mid-year
Yeah.
that wasn't included, we'd also try to iterate to make sure that it is the most up to date on the site.
Beautiful. Thank you. Yeah, and just thanks again for all the great data that you provide. This is really a wonderful resource.
I'm glad you find it useful.
Kelly, this is Audrey Berner from Eau Claire, Wisconsin. If we had funding and a local metric that the one I'm thinking of would be something that's collected through the YRBS survey. So there's, some level of standardization there.
Mhm.
Are you open to customizing individual city dashboards with something, a local metric that we provide? Or does it not go that way, that direction?
So that's a great question. And we're actually right now working on sort of a pilot project at looking at more customizable data within cities. So unfortunately, I don't have an exact yes or no to that question right now. But if you do have something of interest, again, I just encourage you to reach out to us and kind of share what that specific project might be. And we can have our team kind of take a deeper look at it and look at what that might look like. But I know there are hopes and dreams for our site moving into the future of being able to have a bit more customization to be able to combine with, other data or make sure that cities can print out kind of fact sheets or whatever it is that might be useful. And so we'd love to hear from you a bit more on kind of what that would look like for you and seeing if that is a feature that we can add in kind of future site iterations. But as of right now, we don't currently offer that.
Sure. When you said early on the data that you try to do regular updates, so if we were considering a local metric, what would meet your standard for how regularly it would be updated? Do you know that offhand, or is that all sort of up in the air also?
It's a bit up in the air. I'd say as long as that data source, so all of our data that we put on the site, it's all available from other data sources. So once that data source is updated, we try to include it in the next upcoming data release that is planned for the site. But that is a bit dependent on if we're able to work with that data, if we're able to get that on the site, and also how often that local data source is updated might not be as regularly, say, as more national data sets.
Sure. Yeah, that makes sense. Okay, one more question then.
Yes, of
So
course.
chronic absenteeism, you said it was elementary and secondary students. Are there other metrics that are kind of just the youth population or other metrics that can be filtered by age to just the youth?
So
On 18 and under or something?
yeah, so we don't have the ability to filter by age on our metrics. Unfortunately, a lot of the data sources don't actually provide a lot of age information for some reason, even though I personally think that would be super useful. But we do have some metrics such as children and poverty, which does cover youth populations. We also have um, not quite youth, but high school completion. It does look at adults greater than 25 that have completed high school. It's not quite the youth population, but it is looking at have they completed something that youth often do complete. And then there's also third grade reading scores. This is looking at students in the third grade level. So those are some metrics off the top of my head that do kind of look a bit more at youth populations. I just also realized we also have teen births on here. So we do have a few metrics that kind of look at that, but nothing that specifically allows you to filter by that age criteria, unfortunately. Any other questions? Oh, I see I have a question in the chat. How many cities are currently on the City Health dashboard? So right now on the City Health dashboard, we have 973 cities. There's unfortunately kind of no way of looking at, well, you can look at this map here and also on the About page, we have this beautiful little map that allows you to kind of toggle over and see what cities are currently on the dashboard. If your city is not currently on the dashboard, or you have a city that you wish were on the City Health dashboard, in February of every year, we hold what is called the Put Us on the Map Challenge, where we invite cities or representatives from those cities to submit an application to get their city to be put on the map. We currently have every city on the dashboard that has a population of more than 50,000. We are mainly holding this sort of application process each year for cities that are less than 50,000, as those cities often aren't included in a lot of the national data sets, but we want to make sure that we can get data for those cities because oftentimes those smaller cities have the hardest time accessing local data. So yeah, if your city is not on the dashboard, feel free to let us know and we'll ping you as soon as that application is open in February. It's a lot of cities have been able to get on these past 2 years through that process, and we've continued to expand. So hopefully this year we'll be reaching over the 1,000 mark. But we keep trying to add every year to make that number grow.
Hi, this is Martin from Greensboro, North Carolina.
Hi.
One of the things we're looking at pretty deeply, I think a lot of cities, is attainable housing and rent burden. And so I typed in our city, but I couldn't go as deep as I wanted to. And so I was wondering if you can help me navigate that.
Yeah. Do you mind repeating once again
Yeah,
your
Greensboro.
Greensboro?
That's it.
Perfect.
Yep.
And so what metrics were you interested in?
Around housing, so the one that I saw was rent burden.
Yes.
Oh,
Yeah. So
interesting.
once you click onto that metric, you're able to see your city here. You can kind of zoom in a bit more to get a better image. So yeah, we have all the rent burden years all the way through to 2013. So there's quite a lot of years on here for you to kind of look through. And then again, if you kind of click on, you can, well, that wasn't a good example, but there's certain kind of estimates for all these census tracts and you can kind of see where they land. I'm trying to think other metrics that kind of are proxies for housing. We do have a housing with potential lead risk metric, which doesn't necessarily talk about accessibility to housing, but it does talk about kind of the environment and the environment around housing. I'm trying to think. Children in poverty could be a proxy. And there's a few others that you can kind of explore here. Um, any other Do you want me to navigate a bit more in this space? Any other specific questions within this metric that you have?
Um, no, that's good. I saw there was something exposure to lead.
Yes.
That might be one.
Yeah, we have a lead risk exposure index. So this one is actually a metric that we calculate here on our data team. So we've combined a few different data sources to kind of have a proxy of different things that might increase your risk for lead exposure. And if you have more questions about this particular metric, you can read more on the metric kind of detail page that walks you through what is this 1 to 10 scale? How do we actually measure it? What does it mean if you have a 10 versus a 0? So that's kind of a useful way to get a better idea of what that metric's actually talking about. But this one, again, we have multiple years of data, I think all the way to 2013 again, which is nice to have all those years to kind of look at and compare.
That's great. Thank you.
Yeah, of course. Thanks for asking.
Yeah, you may have mentioned it, but can we get a link for the recording?
Yeah, so once this session is done, I'll be sure to send out and I'll email everyone that attended today a link. And then also I might as well show you while I'm on the site. On our about page, if you go down here to touring the City Hall dashboard, we actually have a virtual office. Oh, well, that's awkward. We have a virtual office hours page. I'll have to fix that link. Virtual office hours with the City Hall dashboard, and I'll actually send this link right now in the chat to everyone. But this page has all of the recordings from all of our past virtual office hours, and then I'll also be posting this recording here for the first recording of 2024. Exciting. So that you'll be able to go back and watch that at any time. But yeah, I'll be sending an email out to everyone afterwards. So if you want to go back through and watch the recording, or if you have any other questions afterwards, feel free to reach out to me. I'll email you guys directly, so you'll have my contact information. And I'm here if you need any help.
Thank you.
Yeah, of course. Also, if you haven't yet already, I would love to kind of hear what cities everyone's coming from. If they don't mind just popping that in the chat. I always love to see kind of where people are coming from when they're joining these sessions. And of course, feel free to hop off mute if you have questions or send them in the chat. I'll be staying on the whole time, but if you don't have any more questions, feel free to hop off. And again, I'll send the whole recording of the session to everyone afterwards.